There's some data being presented on novel combinations, and particularly one that caught my eye was the combination of Bendamustine and Rituximab with Venetoclax, which is the BCL2 inhibitor. This is a phase 1 study, dose escalation study, which demonstrated clear responses and actually that there was clear efficacy with actually fairly acceptable toxicity. So I think that's a really interesting combination to keep your eye out for. There are other new combinations with Bendamustine and Rituximab coming through, with idelalisib and ibrutinib, not reported at this meeting, but all being investigated. So I think that Bendamustine Rituximab backbone is going to be vital with an additional novel agent as we move forward in the future. There was some interesting data also on subcutaneous Rituximab, and this time in diffuse large B-cell lymphoma. So this was a study in patients who were previously been untreated, and they were given CHOP chemotherapy, and similar to the study that I described and we reported, they were randomized between intravenous Rituximab and subcutaneous Rituximab with their CHOP chemotherapy. And what this demonstrated was clearly comparable overall response rates and complete response rates, and a very similar safety profile between the IV and the subcut formulation. Perhaps those patients with subcut administration had a few more administration-related reactions, so generally some redness or some swelling or some mild discomfort at the site of the injections, but really very well tolerated. And again, that has implications for time that the patient spends in the chemotherapy day ward, and actually obviously if we can administer over a much shorter period of time, that has a clear impact for us as healthcare providers. So that was preliminary data. Obviously I think a lot of people are interested in seeing time to event analysis on that study rather than just overall response rates, but it gives us a very clear signal of safety of a switch in formulation.